following segment is sponsored by Baptist Health.
Well, ladies, listen up, especially anyone that's either experiencing menopause or knows someone that is. We're joined by Mandy Burton with Baptist Health Urogynecology Clinic. They specialize in the unique conditions that impact women, especially during menopause. And there are new guidelines that could impact you. Mandy, thank you so much for being here today.
Welcome.
So specifically, we're talking about guidelines concerning GSM. What is GSM?
So GSM is genitourinary syndrome of menopause, and so that is what happens to a woman's pelvis usually 8 to 10 years past the time that you're having night sweats and hot flashes.
So what exactly then is the Medical Society's guidelines?
So the AUA, which is the American Urologic Society, they came out with new guidelines 2 months ago, and this is 6 years in the making. And so they want us to know that there are specific treatment recommendations surrounding GSM. And the number one recommendation that you can do to treat and prevent GSM from happening is vaginal estrogen.
Okay, let's talk about vaginal estrogen, because I think there's a lot of concerns around estrogen. One being, can it cause cancer?
Yeah, so that's the number one fear that I hear from my women in clinic is when I say the word estrogen, you can see the fear over their faces because they don't want to get breast cancer. Or they're a breast cancer survivor and they've been through that trauma and they don't want anything in their bodies that is going to put them back into that space where they were going through treatment for cancer. So vaginal estrogen is safe for every woman, except if you have unexplained vaginal bleeding or if you've had a uterine seroma type of cancer. Besides that, your 97-year-old great-grandma can use vaginal estrogen. It's just a topical. So I kind of explain it to my women. So a topical Benadryl versus an oral Benadryl. The topical just stays on the skin where you put it. A pill goes systemic, so it goes everywhere in your bloodstream. This is just a topical product that stays in the vagina and gets to the skin of the vagina and helps the bladder symptoms as well.
So obviously we have estrogen naturally. So where did that fear come from of putting more into our bodies would cause all these other issues?
I'm so glad you asked about that. So in 2002, the Women's Health Initiative study was released to the public by the media before the scientists could even review the data. And so that Women's Health Initiative study, the media told the public that estrogen would cause breast cancer. And so overnight, all the women dumped their estrogen down the drain. And now only 4% of women in the United States are treated for menopause because of that study. And so the estrogen kind of got a bad rap with the WHI study, but now we've walked, or not we, but the scientists of that study have been able to get out to the public actually how safe the estrogen is and how it can prevent things like colon cancer. It can even prevent breast cancer. It can help with dementia. It can prevent genitourinary syndrome of menopause.
So there's, when you open up the box, if you actually don't mind opening up and showing what this looks like, but there's a big warning on the label. So are we just supposed to disregard this warning now?
I know. So it's so hard as a clinician to be able to tell our women who actually read this pamphlet, and there are those women out there because I get the messages from them who say they don't want to take it because the warnings of this pamphlet say that it's going to cause probable dementia, blood clots, and breast cancer. And so we are actively trying to get this warning taken off of this product. We're petitioning the FDA. And so hopefully in the next, months to a year, that will be off of the vaginal estrogen because we know, based on science and data, how incredibly safe this product is and that it does not cause cancer. It doesn't even enter your bloodstream. You can be on vaginal estrogen for a year and I can draw your blood and your estrogen levels will still be 0 if you're in menopause and not taking a systemic hormone therapy.
So let's recap again. Who would need to use this vaginal estrogen, and is it prescription based? Can we get it over the counter?
So it's actually over the counter in a few other countries, but not this one. So the cheapest way to get vaginal estrogen, it is a prescription, but the cheapest way to get it is Mark Cuban's pharmacy. It's located in Florida, and it's $13 a tube, and this tube will last you 2 months. So it's incredibly cheap and so safe. So the people who would need vaginal estrogen are the people who are experiencing symptoms of GSM. So symptoms like urgency to go to the bathroom, frequency, incontinence, pain during intercourse, vaginal dryness. All of a sudden, if you are aware of your genitals and you're in the menopause, perimenopause timeframe, then it's a sign you could need vaginal estrogen. Also, women who are breastfeeding, their estrogen levels are lower. People on birth control pills, you can also have symptoms of GSM, and so you can use it at any time. It is safe for any age woman to use.
Mandy, great information from you. If somebody has questions or wants to reach out, what's the best way to contact Baptist?
Yeah, so I am at the Baptist Urogynecology Clinic, and so we are in Med Towers 1 on level 2, and you can call us at 217-4910.
Perfect. Thank you so much for joining me today.
You're
really
welcome.
Appreciate